During the time of the early humans, they based their action based on observation, trial, and error. They strongly believed that illnesses came from the magical spirits, the earth, and the air. Their knowledge is passed down verbally and written down for the next generation. Egyptians are renowned for their strong sense of cleanliness and were considered as the healthiest people. They formulated the world's first hygienic code, the biblical book of Leviticus. They practiced protection against the spread of contagious diseases, isolation of lepers, disinfection of dwelling after illness, sanitation of campsites, disposal of excreta and refuse, protection of water and food supplies, and specific hygiene rules for menstruating women and women who had recently delivered a child. Greeks were the first people to put emphasis on disease prevention rather on treatment of disease condition. Asclepius was a Decelean chief who had received instruction in the use of drugs. He had two daughters who also had health-related powers. Hygeia, bestowed with the power to prevent diseases, whereas Panaceia was given the ability to treat diseases. They have their symbol called the caduceus. It shows two snakes braided around a staff. This symbol was left by Asclepius as permanent reminder of the past. Meanwhile, Hippocrates, the first epidemiologist and the father of modern medicine, observed and recorded association between certain diseases and such factors as geography, climate, diet, and living condition. Together with Asclepius, they moved the healthcare away from religion and the priests and attempted to establish a more rational basis to explain health and disease. Roman excelled in engineering and administration, water transportation system for safe water movement, and underground sewage to remove waste. They also observed the effect of occupational hazard on health. Romans were the first people to build hospitals. They furthered Greek studies such as advancement study of human anatomy and surgery. Let's proceed with the Dark Ages. During this time, they built fortresses. The places were overcrowded and had poor sanitation. During early Christianity, they believed that diseases were caused by sin or a result of disobeying God. It was also the time of great epidemics such as bubonic plague, or also known as the Black Death. The death toll during this time was higher, and the disruption of society is greater than from any war or natural disaster in history. The Renaissance, which means rebirth, was a time when diseases and plague were still rampant. Bloodletting or water casting together with surgery and dentistry were also popular health practices during this time. Printing press was also invented and enables the writings to be reproduced. There was also scientific advancement during the Renaissance period wherein the human body was again considered appropriate advanced study. Anthony von Leeuwenhoek discovered the microscope and proved that there was life form from the human eye to see. This was also the time of Age of Enlightenment, which believed that the mind and body were dependent on one another. Miasma's theory of disease remained popular throughout much of the 19th century. It was also the first time that Edward Jenner discovered a vaccine produced for smallpox. In the first half of the 1800s, little happened to improve the public's health. After that, the first phase of the development of organized healthcare started. provision of instruction to clients with tuberculosis and other communicable diseases. In the 1850s, the first mandate to teach physiology and hygiene in all public schools was released. In 1914, demonstration projects began and a large-scale measure was developed to know the health status. In 1920s to 1930s, many studies were conducted to design and clarify the role of health education. Lastly, in 1950, health education began emerging as an integral part of elementary, secondary, and college curriculum wherein patient education was also included in hospital programs. As the world continues to adapt to the advancement of the healthcare system, various instructions to mothers of newborns are given. It includes immunization, sanitation, prevention, and treatment of infection diseases. The World War II changes in the healthcare delivery system occurred. In the mid-1960s, patients were recognized as healthcare consumers and were given the right to avail healthcare services. The era of prevention happened in the 1970s. A year after that, in the 1971, Coalition of National Health Organization was formed and two significant events happened. Publication of needs for patient education on disease and treatment, and hospital health personnel offered health education to families of patients. In the year 1974, Center for Disease Control and Prevention or CDC was established. In 1979, Healthy People, the Surgeon General's report on health promotion and disease prevention was published. One of the important historical events for health education is the year 1980. In this year, promotion of health and prevention of disease was strengthened. Initial role delineation study for health education was taught. The examination of professional preparation program and professional competencies were conducted and led to the first certified health education specialists being recognized. Let's now move on to the 1990s. National Health Education Standards and Responsibilities Competencies for Entry-Level Health Educators were published. Health educators were assigned to a specific designation. In 1993, the Health Profession Commission recommended a scope and training program for all health professionals to maintain competencies. As years passed by, those advancements in public health led to establishment of the Unified Code of Ethics, report of Joint Committee on Health Education and Promotion Terminology, and promotion of Certified Health Education Specialist. There is also revised National Health Education Competencies that include 3 levels based on competencies updated project. Lastly, outcome-based education and practice took place.
Pagkasabi ko na iikot ha.
Nagbasa lang ako.
Kita. 1, 2, 3, go.
Wait lang!
Tapos makita mo na sa blue.
Hindi ako si Pat.
Hindi na kasi ito mga.
Hindi sila pa rin.
Pwede ba namin hawakan ni Seth?
Sige, tuloy lang, tuloy lang.